you know, in the African American community, we need more mental health professionals.
Absolutely.
Not only do we need more male technicians, but obviously we need more African American male technicians.
I'd agree.
And you definitely have my interest piqued, Alfonso, with the conversation that you had with me about the initiatives that you want to get started in promoting male health.
Right.
I think that you brought up some very important aspects. As a matter of fact, I'd like to pose a question to you guys and ask, what is it that you think that we can do here at Charles Drew to help better promote male health?
I would say one of the most important things is building positive relationships for males to feel comfortable and to come in and that it's okay. And not only is it okay, but it's a necessity that you take care of your health. And from a mental health standpoint, you have to have clarity and mental health to be in the right frame of mind to take care of your family. Because if you can't take care of yourself, you're not going to be good for anyone else. So taking care of the mental health part of it is very important.
Well, let me ask you this. What do you feel are some of the main barriers that prevent men from seeking mental health?
The stigma that I'm okay, I don't need medication, I don't need to go take a physical, I don't need to check for prostate cancer, I can handle it on my own, I don't need counseling, I'm not crazy. And those are all false stigmas that we have to get past and understand that everybody needs help.
I once heard someone say at a seminar that going to mental health is because your emotions are sick, just like your heart gets sick, just like your kidneys may get sick. When you see a mental health, it's just because your emotions are not doing well at the time. Would you agree with that statement?
Absolutely. Emotions, stress, anxiety can make it to a point where they have to come see you. So if you take care of it on the front end, of reducing anxiety, stress, and handling your emotions the right way with the right coping skills, you can avoid a lot of doctor bills.
All right, good point. Anything else that you guys think would help us to promote male health better?
I think just talking about it. I mean, a lot of people, I would say, do not have a vocabulary for talking about mental health. It's not that I won't or I don't, but just being able to have mental health, just health in general, but it's particularly mental health just spoken of. We don't do it enough. We think about it in terms of being crazy, but what is it about just being able to have a group of men that you can talk to?
I think that you guys have made very good points about mental health. Is this only applicable to mental health, or are these principles also applicable to medical health as well? And if so, how?
I would like to elaborate on that for me. We relate mental health to medical health because we have actually medicines that prevent certain issues when it comes to mental health. To get people to take anxiety medications, you must build a rapport with the patient. Your mannerisms come into play. And the way you room a patient and the way you talk to them and let them know that I'm here with you, that whatever you're going through, I can get somebody to help you just for that particular situation. So when I'm being an MA, my main thing is to get the patient comfortable. I once had a patient that came to me and said, you know what, let me give you a hug. I said, why is this hug? He said, you know why? He said, because they took 2 polyps out and you pushed this Hidden Nicole card to me the best way you could. And I love you for that because just give me a hug. He gave me another hug and I said, I appreciate that because the Hidden Nicole card is very patient worthy, shall I say. What it lets the patient know is that if there's anything cancerous that can be left in the colon. These types of illnesses causes pain throughout the day for a patient, pain in the stomach that they'll continue to ignore. It'll cause a behavioral issue, which a patient will be neglected towards taking any type of medication. And they'll come in and they'll say, oh, I'm not taking that test, there's nothing wrong with me. Or I feel fine, or they're not gonna go up inside me and do this and that and the other. But once you let them know the importance of it, then you get those types of hugs in which I did.
So if I hear you correctly, what I hear you saying is that the way that we relate to our male patients can have a significant impact upon how far we're able to affect their health.
Exactly, they'll be able to relate to us better.
Alfonso, would you elaborate on the conversation that we had? You came to my office about a month ago and you told me that there were several things that you had a passion for that you thought could really affect the male health in our community. Would you elaborate on some of the ideas that you came to me with?
Yeah, I think just starting a conversation like we talked about here with behavioral health, starting that conversation and just having a forum where we invite people in to come in and just talk. With men, what I found the best, that's why I love going to the barbershop. You just have conversations. There's no off subject. If it ain't time, then they'll let you know it's not time. I think we need to do the same thing when it comes to health and not separate, and I don't know why we do so much. We separate the body into these different distinct pieces. You have the behavioral health for the head, you have physical health for everything except for the teeth. It doesn't need to be that way. Let's just have a conversation about health. Let's take it medical. But then also addressing, there are different areas. So you have behavioral health, but then also looking at financial and looking at how that plays a part in stress, which is then behavioral health, and looking at you have more than just sexual health. Men care about more than just sex. They have to, because the men that we're dealing with in particular, we have a lot of fathers. We have our Fathers for a Lifetime program. You can't just always bring up sex. That's not enough. It's good to get you there. But looking at what about the diabetes? What about high blood pressure? What about these other areas of health that are very important?
I agree with you perfectly. It's interesting that you mentioned the Fathers for a Lifetime program. I've had the privilege of speaking there a few times. And what I really like about the Fathers for a Lifetime program is that it not only focuses on fathers having a better relationship with their children, but there's actually one entire session that's dedicated to nothing but male health. And the focus of that day is to say, how can you take care of anyone else unless you take care of yourself first? So that's just one of the many programs that I think that we have available to help with that. Now, we've mentioned several times here today that it's important to how we interact with our male patients. So can you all tell me how you feel working at Charles Drew as a male? When we have 25 male employees, but we have over 100 employees total. So how do you feel working in an environment where there are not that many men present?
Well, I think that's also a reflection of our society and our community, that we need more fathers and dads stepping up. And that means that you have the responsibility of taking care of your own at first, because you have to show that you do it at home first. Then once you do it at home, you also have a responsibility of doing it in the community. So I take pride in also being a role model for my kids' friends and making them feel welcome, and also doing volunteer coaching, football, basketball, so that I'm in the community making a positive impact, and not just teaching sports, but also teaching values and bringing up some of the things that they may have not had an opportunity to get from a male. So,
Alfonso, I'd like to pose that question to you because the three of us interact more in a patient setting, but you actually are more out in the community, much more than we are. So your influence can be spread much further throughout our community. So I'd be very interested in hearing how you feel working in this environment.
As being part of the senior leadership and being a male, it feels good to be in an environment where you're with other men who know what's going on, that you can see. Just being in health services is really a lot of females that work there, which is great. I'm blessed every day because of what I do. It impacts other people's work. And I go out and I sit with a group or an organization and say, how can we help you? How can we serve you better? How can we be good partners? Trying to manage those expectations of what it is that they think that Charles Drew does. Every day I have the opportunity to say, did you know Charles Drew does this? We have behavioral health. Do you know about our Fathers for a Lifetime program? Have you ever participated? Looking at the dental program that we have, knowing that we have male doctors on staff, African-American male doctors. It's important for me, the way I was raised, to be able to see African-Americans in a position of authority, in a position of influence that's not abused.
Paul, we're very glad to have you. Since we were talking earlier about the Fathers for a Lifetime program, as the coordinator for the Fathers for a Lifetime program, can you tell us how you feel that this program impacts male health in our community?
I think it opens up a forum to get the word out more about men's health, about men's sexuality. It's probably been one of the big things that comes out of it. Kind of has given the guys a little more knowledge about and help to dispel some myths about their sexuality.
I've had an opportunity to read some of the feedback from some of the attendees, and one of the feedback responses that stood out to me most was one father and participant said that Fathers for a Lifetime had managed to touch on all of the most contentious aspects that he was experiencing in being a father. He talked about how it helped him to see the other side of child support, how it helped him to realize that as a man and as a father, it's up to him to diffuse the situation between he and his child's mother. And also, he said it just was very nice to be able to talk to a judge and find out what his rights were. So I just can't stress how important these programs are, not only to us, but to the community as well. Go ahead, Paul.
And I think that's important, and I try to stay up on that. What is the hot issue, or what is something that we need to address? So one of the things that I think everyone's aware of, domestic violence is definitely plaguing this community and other communities as well. And so we have gone and tried to really address that with our 8-week class, speaking just strictly to domestic violence. With that, you can't go and just focus on domestic violence until you can help them to see what's causing the anger, what's bringing the anger, what's making them that. And so we have some classes that are taught by our therapists on anger management.
Kevin, you had mentioned earlier that part of the responsibility that we have is being a role model, not just in the clinic, but at home. Can you all tell me how is it that you feel that your presence in the home helps to set the tone, not just in seeking medical care, but overall period? How does your role as a father affect your household?
Because as a father, and me being a father of 4 boys, I think it's very important for them to see work ethic, them seeing that you getting your education is key. Fathers teaching their kids to respect and to respect women, because if you instill that in them at a young age, then you don't have to worry about domestic violence because they respect women, they know not to put their hands on women. If you lead by example, then they're going to want to emulate their dads. So fathers are the key. I mean, a lot of our community problems are fathers stepping up and doing their job in their homes. If everybody took care of their own kids, we wouldn't have a problem.
Yeah, I think it's just in general, you can't delegate responsibility on your authority. And as from the biblical principles that I am raised with as a Christian is, I am responsible. When things happen, I'm responsible. You have people, whether it comes for your health, the mental health, behavioral health, but all the health, it doesn't matter. I think it's important that we have programs like Fathers for a Lifetime because of the home situation for a lot of African Americans. They don't have a father in the home.
Well, I think as fathers, we have to model appropriate medical care, what that looks like in our household, whether that be getting a dental exam every 6 months, getting a yearly physical, once a year. So our kids being able to see that at a very young age, that those things are important. And a lot of times men tend to shy away from going to the doctor. But if our young children can see that we're doing that, at least once a year, getting all those types of physicals that we need, checkups that we need, and things like that, the kids are going to be more likely to do it as well.
Well, one of the things that I try to do is be an example in exercising. I get up, my alarm goes off around 5 a.m. I go to the YMCA, and I get to the gym around 5:30. And so I have a workout of about an hour. And then on an annual basis, I always do an annual checkup with my doctor. And I've been doing that for a few years now. So I think it's all about being an example.
I hear all of you say that it's about being an example. And what's interesting is that that's exactly what the studies bear out. Studies say that a father who exercises with his children, that child has a 90% less chance of becoming obese as an adult. Studies say that if a father has an active presence in his daughter's life, then she is significantly less likely to become a teenage mother. Fathers that are involved with their sons, the sons have a significantly higher graduation rate, significantly lower dropout rate, and they have a significantly lower rate of smoking and drug use. And what's interesting is that these statistics are not only for fathers that are present in the household, these are for fathers that are present, period. So even a father that's not in the same household can still have these positive effects. I really want to thank all of you for opening up and telling us a little bit about yourselves and your unique aspects and attributes that you bring to Charles Drew.
We are Charles Drew.